We are now ready to move on to our next session, which is From Entitlements to Empowerment, ensuring last mile access to social security.
Manjeri Sakhi FPC reflects women's strength, sustainable agriculture and thriving rural future.
आमच्या या प्रयत्नासाठी होणाऱ्या सन्मानाबद्दल आम्ही आपले मनपूर्वक आभारी आहोत.
I know tea and entertaining discussions go hand in hand, but it's time to get back to business. And now may I invite on stage the esteemed panelists for this session. Please join me in welcoming on stage Ms. Mirai Chatterjee, Director Seva, Social Security and Chairperson Seva Cooperative Federation. I warmly welcome Mr. Aniket Doighar, Founder and CEO, Haq Darshak. Next, I welcome on stage Ms. Madhu Khetan, Integrator Pradhan. We are all looking forward to a very invigorating and enlightening session. We promise you a very interesting discussion ahead. Once again, delegates who are moving about, you are requested to please kindly take your seats. With that, I hand it over to Ms. Sharon Buto to take the session forward.
Thank you very much. Happy to have the end of day session. It's not immediately after lunch and it's right after the coffee break, so we might have an interesting turnout. I'm very happy to do, and it's an immense pleasure to be with the panelists on board. Some are people I know a long time, and some are people I should have known a long time ago, so pleasure to reconnect as well. I think the topic of social protection is not new to anybody. I think India has built a vast and ambitious social protection architecture, but still millions remain in the informal sector. Workers are without social protection, migrants, tribal household, they still remain excluded from the social protection area, and they're not having the benefits they're entitled to. And when I go to very similar meetings to government, they all say, no, we have schemes. So between the, there is and there is not, I think there's a lot of scope to do a lot of work there. So it's not about designing schemes and saying to create them, it's about delivering them, no? I think it's also about innovating on them, because we live in very exciting times where technology could help deliver as well. We might even need to reinvent the term social protection. What does it mean in light of our changing workforce, where people might not have the same architecture of work that we imagined like 4 decades ago? That might go away. So what does social protection mean in that way? So I'll start with my panelist, Mirai Chatterjee from Seva. And I'll have a positive and sort of like a more little bit challenging question. I'll start by the bit challenging one. For your decades of work with informal women workers, I would see that the typical question, what are the most persistent barriers? It's the most simplest and to ask, the hardest to answer, because gender barriers is very vast in accessing social security. After that, I'd love for you to elaborate on when there is social protection, how does that give voice and empowerment to women? How do you make that connect there to make it all worth? Yeah.
Thanks a lot, Sharon, and thanks a lot to Access India. Here we are, and it's wonderful to be here. Sharon, you asked about social protection, so I thought the first thing I should say is, in our experience at Seva, working with informal women workers, people who have no employer and mostly self-employed, by social protection, we mean they need at least health care, child care, which we heard a lot about this morning, insurance, pension, and housing with basic amenities, like at least a tap and toilet in every home. So coming to the barriers very quickly, the first barrier I would say to access is the way the schemes are designed themselves. The schemes are designed in a way with very little consultation. There are, of course, instances of when government and others organize consultations, but by and large, these schemes are top-down schemes with very little input from people at the grassroots, from Dalits, Adivasis, informal workers, and other vulnerable groups. The second one is one that this audience would be very, very familiar with, the second barrier, which is information asymmetry. People simply don't know. They don't know what are their entitlements. They're not aware of them. And the other issue, of course, is that the schemes keep changing. You know, some they add on, like PMJ, add on the coverage and so on. But this is also a gap. And also the language of the scheme. Sometimes the schemes are not simple to comprehend. They're quite complex. And then, as I said, they change. And also language. You know, we can have very Shuddh Gujarati language, but in the colloquial language that is actually digestible to local people, that's also important. The third and very important one is how to access these schemes. It's one thing knowing about them, but how do I actually get my entitlement? How do I actually get the benefit of the schemes? And this is the most tricky part. First and foremost, the documents. We were just discussing here that still large number of our fellow citizens, and this is true of our members as well, don't have Aadhaar cards. I mean, it's improving all the time, but they still don't have Aadhaar cards, they don't have their birth certificates, death certificate, and so on. One particular issue with women, Sharon and my colleagues, is the issue of names. The name on the ration card is not the same as on the voter card or on the Aadhaar card. So a lot of time is spent aligning all the names. And then how to navigate, how to actually get the benefit. Digitization is there, and I'm sure we'll hear more from you, Ankit. That's a welcome development. But there's still a gender digital divide. There's still a smartphone, one in the family, and we all know that usually it's in the hands of the male family member. I'd like to tell a very quick story of Jyoti Ben, who I met a little while ago, a woman farmer, few hours away from Ahmedabad city. She had been widowed 40 years earlier. She had no idea how to access her widow's pension. Fortunately, in her village, we have an information cum empowerment center. We call it Seva Shakti Kendra, where women get information, they get help with digitization, and also how to navigate the schemes. And local women have been trained up, in our language we call them Agevans, to actually help with the facilitation, because they're familiar with all the schemes and so on. So Geeta Ben went to Jyoti Ben, and it took several trips. And finally, to cut a long story short, with the facilitation of the local woman, the Agevan Geeta Ben, Jyoti Ben got her pension of 1,250 rupees after 40 years of being widowed. But it took a year. And she had to spend 3,000 rupees and several trips. And I'm sure all of you have plenty of stories like this. So both with online and offline, facilitation is key, even to open a bank account. I see Mr. Bhatt sitting here from FWWB, our sister organization. But for rural women, particularly in the interior parts, Adivasi women, just to open a bank account is a marathon, still, after all these years. The third thing I would like to mention is, it's the fourth thing, is discrimination, gender discrimination. But also when our sisters go to try and talk to the local officer at taluka level, tehsil level, to access the schemes or to get certain documents, they face discrimination, particularly if they are Adivasi, Dalit, migrant workers. Why have you come to our state, they ask. And of course women. And then there's the issue of intersectionality. They're women, but they're also Adivasi, they're also poor and so on. And finally, if I may say so, the last barrier is our own socialization as women. Women don't prioritize themselves. This has been known for years. I mean, health-seeking behavior, for example, of women. They prioritize everybody else. If it's a child or their husband, they rush off, they don't mind. But for themselves, it's a completely different issue. And also a lot of these schemes have conditionalities. I remember one scheme, fortunately we were able to remove the condition, which was that if you want your maternity benefit, you have to show that you're breastfeeding. Now who's going to certify? So some of the schemes have these kind of rather odd conditionalities. I want to just end the barrier part by reminding myself of a case that still gives me the shivers of after the earthquake, a Kutch dairy farmer who we met, she had broken her leg. And she was dragging her leg around for 3 weeks, not seeking care. And when we asked her why, she said, who will take care of my buffalo? Who will take care of my household? Who will cook? I have a young daughter-in-law, she's just given birth. So these are some of the barriers, and there must be many more from this room. Very quickly, how do collective organizations change the way women engage with social protection systems? And I think if there's one thing we at SEVA have to share with all of you, it's the power of organizing. Maybe I don't need to convince you, but this is the basic building block. Building unity, building the solidarity, and in our case, building the sisterhood. And then coming together and creating your own membership-based organizations or collectives. And the collectives give the women the bargaining power and the collective strength not only to access their entitlements, but also to interact with the social protection system and push for changes, sort of bottom-up push for changes. They also obviously get information. Then they co-create innovative models. This is something that you mentioned, I think, Sharon, in your opening remarks, and I'd like to just give 2 quick examples. One is the National Insurance Vimo Seva Cooperative, which is our country's first women-owned, women-run insurance cooperative. And this idea came from the women about 30 years ago, because that time there was no PMJ, there was no health insurance. But the point I'm trying to make is that not only did they invent, but then government came to see how it could be scaled up. The Labor Department people from Delhi came, spent 3-4 days, talked to the women, and that's empowering. When they feel someone is asking them questions, learning from them, it's very empowering. And the same was with the insurance regulator. Their entire team came to study how microinsurance can be scaled up for the rest of the country. Similarly with childcare, we are now in discussion with Niti Aayog and looking at costing and seeing how childcare can actually be universalized and be full day. So there's a lot to say, a lot more to say, but also, as we know, these organizations build women's voice, confidence, and leadership. And I'll stop there.
Thanks a lot, Meera. That's a lovely perspective. And it really highlights that social protection takes on many forms, no? It's the immediate need, but also the care also after, like you mentioned as well. There's a lot of work to do. So I'll pass on my question to Madhu from Pradhan. And I know Pradhan has done phenomenal work in some very difficult areas in India, the most difficult, remote tribal areas and things like that. When often we talk about last mile delivery, I think in Pradhan case, it's the last 100-mile delivery. I think it's exponential, no? It's extremely difficult, but it's critical because those are the people that need it the most. Love to hear Pradhan's experience, but as well, the experience of using Pradhan's vast history of community platforms and self-help group. How do you integrate social protection within the vast livelihood ecosystem that you've created? Yeah.
Thanks, Sharon, and thanks also to Access for this organizing this and having us here. So just to give some context, Pradhan works in these 7 states which are home to bulk of India's poor. Around 60-70% of India's poor people live across these 7 states, and broadly it's called the Central Indian Tribal Region. So, of course, I'll come to the specificities of, what causes and what are the persistent barriers. But before that, I'd like to, also say a little bit that, on the one hand, government data is saying that the number of people, proportion of people that are multidimensionally poor has kind of gone down from 25 to around 15%, which is some progress. But still, there is a correlation of poverty or multidimensional poverty, particularly with certain social groups. So, for example, we know that 5 out of the 6 multidimensionally poor people in India belong to either, SC, ST or OBCs. And also, if you look at educational attainments, if you look at jobs, etc., there is a specific correlation with these social groups. Of course, we also understand, and the evidence is that DBT has kind of, on the one hand, made processes more efficient. So we know across the states, that there is a fast transfer now of resources. What it's also doing is that there are certain groups. So within these groups also, SC, STs or OBCs, we know that it's not a homogeneous category. So there are certain groups which are maybe more advanced, for lack of a better term, than others. This fact is, also becoming very clear that there is a disparity within these social groups also. The STs, the slightly more mainstreamed among the SCs or the STs or the OBCs kind of tend to get these benefits or scheme benefits much more than the others. For example, the case of Musahars in Bihar is kind of very well documented and well known. So that's kind of, I just wanted to share. But coming to, the kind of areas where we work, it's largely, I think, a very, very labor-intensive process or a people-oriented process because, there is you shared, Mirai, that there is of course, schemes not being designed to keeping people, consulting people. So, of course, there is consultation with civil society organizations like us. But, how much do we also know about people's realities? That's also a question in my mind, particularly, so we might also be, we're taken as a proxy for maybe, voices of the poor, but I think there's a limitation there also that we need to recognize. So it's very, very, in our case, relationship-driven and mediated by community institutions, as Mirai, you also shared that, we've always kind of believed in collective action, and collective action, in our case, mainly as Mirai said also, it's built on this pyramid of SHG-based institutions. And the SHG-based institutions, also supported by community resource persons, which kind of, democratizes the information asymmetry bridge, etc. The specific, besides the things that Mirai mentioned, one is just the geographic isolation, because these are very, very remote areas and there's a lot of isolation and transaction costs. The other is the low documentary readiness and, availability and identity barriers. The third is just the language is very, very different. The language of the bureaucracy and the language of the people. And I don't mean just the language, but, also the vocabulary, etc. And also the bureaucracy and trust gaps as to what am I getting into. And of course, the power asymmetry. So there's a plethora of middlemen also that kind of come in and also distort, the information, this thing, and the digital divide. Most schemes are kind of taking now digital mechanisms, and we still know there's a large section of people that are not so digitally equipped. So maybe I'll pause
This
here.
is excellent. I do have a quick question. Since you focus on a very specific demographic, which I think is critical, 15% of 1 billion people is still more than the population of Canada. So there's a lot of poor people. So what are the feedback mechanisms that Pradhan provides? Because I'll come to Aniket after. I think some delivery you can solve, but designing is a different issue. If you can just quickly elaborate on some of the points here.
Yeah, so basically in our case, as I said, we've built these federations, which is a little different from the NRLM model of, so these are block level federations, so SHGs, VOs, but then, block level federations. And Pradhan kind of went a slightly different route in its conceptualization of the federation route, in the sense that we said that, we will maybe not get into financial intermediation as an approach, but kind of, focus on social change and, mediating these kinds of issues of access to entitlement. So focus on, issues of gender-based violence, gender integration in livelihoods, etc., and also mediating, entitlement access, because livelihoods is not just a sum total of the private action that you do in your own farm, but it's also a function of how well you're able to leverage additional resources from government to also, augment the kind of, livelihood action that you are able to do. So basically a lot dependent upon local resource persons, building community resource persons, and all mediated by collective action at the village organization level and by the federations. And all this also led with civic literacy and legal rights education.
Oh, very interesting. Thank you. Yeah.
Can I just quickly just clarify one thing? The consultation doesn't mean people like us. We can be there, but the membership-based organizations, the unions, the cooperatives, the self-help group leaders are perfectly capable of saying what they need and how it should be organized. It's both what is appropriate and affordable, but also the process. The process is also very important.
Yeah, that's fantastic. Thanks, Aniket. I think it's appropriate you come now. I think Hadashaka has done a tremendous amount of work. I think, I'll just answer. So I think your Hadashaka has millions of applications in social protection. So I think you have a little bit to say about it. And I think few of the issues that Meera brought on access, local language, maybe that could be addressed. I want to understand still the two friction points that you still need to address, because there's some things I think with technology coming and the promise of that. And as well, I think the gender divide has been highlighted, and I have myself visited a lot of Hadashak's work in the area. So what is the balance between the digital and the human? I think that would be interesting to know from you, yeah.
Thanks, Sharon. I mean, digital has to augment the physical in India, because India is a phygital country. So we can use technology to improve the productivity of agents. So in our model also we have largely women agents. We piggyback on the fantastic network of NRLM and SRLM by training women entrepreneurs who can then use the platform. So we are actually today using AI and such solutions to ensure how can they be more productive. So in 1920, when we also worked together, in 2 hours, if an agent could do 1 application, today she can do 4, which reduces the cost of service, increases productivity. So I think there is a great way for us to not resist technology, but to adopt it in a better way with proper guardrails to make it more democratic. That's the tougher part. How do we not make it biased? Because of course the technology product designers have absolutely no clue what's happening on the ground. So a product manager sitting in Bangalore or Pune has absolutely no clue. And that's where I think the other level of consultation needs to happen more, which is not just the leaders of federations talking to government, but leaders of federations talking to the tech folks to understand what's the reality, how do we create better solutions, what works in Bangalore doesn't work in rural areas of the country. Overall, I think the barriers, how we have kind of tried to make a framework is DEAR, DEAR framework, which is in schemes, is applicable to all schemes, which is discovery, eligibility, application, redressal. So when we started Hak Darshak, we largely focused on eligibility. What are you eligible for? India theoretically has 20,000 government schemes. NPCI has codes of 12,000 government schemes. There is a scheme in Delhi which is still existing, which is from 1948, which is a 1 rupee payment to the clerk going to the British India. This thing, it still theoretically exists. So there is a lot of duplication. The same Indira Gandhi Awas Yojana becomes PM Awas Yojana, but citizens have to do their paperwork again. So there is a lot of this documentation, because schemes is end of the day political, and it is becoming more and more political. So one of the key things we realized is that before eligibility, there is discoverability, because majority people don't know a scheme exists. If I'm a farmer, I don't know rooftop solar exists or water pump scheme exists. So how do you make it more discoverable? Like all of us in the room know health insurance exists, but there is an India which doesn't know what is health insurance. So before we go on and tell them you are eligible for this, how do we tell them there is a product that exists, That is where the bias also comes in when we are designing, thinking, oh, everybody knows about this. So first is discovery, then we can move to the eligibility piece. The application is where the biggest barrier is, because at one point we are trying to drive the Digital India mission. And at the same time, I think there is a large part of the segment which has already been talked about, which doesn't have smartphones or any phones. While there is great adoption of smartphones in our country, I think 670 million, 67 crore people are on smartphones. There are about 40 crore people who have feature phones. That still leaves about 40 crore people who have no phones. So there is, and those are the people who need schemes the most. So how do you build application models which, while we open APIs, we do digital solutions, but how do you augment that last mile agent, that last mile community champion, who could be anyone, could be a Sathi, Sakhi, Gram Sevak, Gram Pradhan, party workers who are actually very active on the ground. So how do we build that? And I think the fourth part where a lot of the ecosystem hasn't worked is on the redressal. So according to government data, there are 51 crore people on Ayushman Bharat, but only about 15 crore people have physical cards. So a lot of people actually don't know where do I go if I have a card. If I am actually outside in Delhi and I have an Ayushman Bharat card, I'll still go to AIIMS or Ram Manohar Lohia because I don't know which is the private hospital I can go to, where I can find a bed. So again, if you are on the system, nobody is servicing you on the system, because entire ecosystem is built on onboarding. You announce a scheme and there is 180 days given to just onboard people. But are they actually using the benefit? Are they finding issues? Can we improve the scheme? So I think that redressal or grievance mechanism only exists for services that all of us use. If there is an issue with passport, then there is a TCS. If there is an issue with tax system, there is Infosys. If there is an issue with visa, there is VFS. But if there is a caste certificate issue, there is no one. You still have to figure out which is the service. The community member has to go door to door. So we don't treat this population of our own, like countrymen and women, as customers. The mindset is they are beneficiaries. So when there is beneficiaries, that customer service doesn't come in. So I think these few barriers still exist, but I still feel like there is a lot of potential for adopting more technology in a more consultative way, where this can kind of, a lot of these, because in other contexts we have solved these solutions in our daily lives, like 10-minute delivery and all those things. So we can actually solve for government benefits, social protection, social security, different kinds of schemes and documents as well.
Great, thanks, Aniket. That's very interesting. I think technology, especially now, I think things has been accelerated and the future is there. My office is based at IIT Research Park, and I always now go through the corridors at IIT Madras, where, sorry to the expression, but tech broke corridors. And you see a lot of these people in front of their computers, programming for decades AI, and now they're here, they need to design a system. And they're not aware at all, the people they're designing for, no? They're not aware of the communities. And there's a lot of work. They're open to it. I've been just starting maybe a year and a half ago, just educating people, like people who are from India, like the Canadian woman telling people, saying, okay. But to Aniket's point, in a sense that, is there a case where technology people have to design for people who use technology and don't use it? Maybe that's the way to go about it. Can we see more people integrated, even someone from the self-help group being in these corridors at IIT, saying this is how we use it and how we cannot use it, and this is who does not use it, no? Do you think what would be the solution for this? Because I think it's an important one. If our systems are built on technology, and technology people are not aware of the various segments of the population, there's a huge danger there. I won't even start on the many dimensions of everything. So you mentioned initially, the technology people don't know, and I think that's a very serious question from what I've seen, from the grounds to the corridors of the people who actually create that technology, yeah.
I mean, I could add it, but I think sitting here, I think both for Pradhan and Seva, when we started for the first year, I thought that I'm building a fantastic product and everyone will adopt it because I'm solving a problem. So first 2 years, we worked with Pradhan and TRF on the ground. We learned in those states because all our assumptions were broken. We thought that people know schemes, eligibility happens. So I think for organizations or young startups who also are innovators who want to build, there is huge scope. One, in technology, like you said, I think the product folks, they need to go back to organizations who've been doing this for years and work with them to understand where there are gaps. Because that, I think, consultation, collaboration can go a long way. And I think, yes, that is broken in our system because we have the IT ministry sitting in central Delhi, but I'm not sure if they have access or how they are
I've been talking to them.
how they're designing the
Three-quarters
products.
said technology is gender agnostic, which I have a lot to debate on that, but yeah. Great. Mira, you have something? Okay, great. Okay. Okay. So my second question, thanks a lot, Annika. We can just, so my now is the wish list type of questions now. So if you had to create some institutional shifts, what would you recommend to have sort of like the ideal model for the informal worker women to be able to gain social protection in all its dimensions? And I say, yeah.
Thanks for that. And I think we've talked a lot about co-creation, consultation, co-designing. So I would say we start there. If you want to take a life cycle approach, go back to the people, listen to them, ask them questions, just now the way Aniket said. And just to, since you were talking about digital and digitization, just recently we joined hands with a tech company and we co-created a digital health passport where all women's documents are digitized and they're also linked to the government's DigiLocker. And the next phase would be that seamlessly they would go from the DigiLocker to the different schemes so that every time they don't have to go up and upload. So I think people are really excited about technology and particularly younger people. It's cool. And also it gives us status, you know. I know how to use this app in my village. I know how to use this insurance app, etc. But coming to your question of adopting, you know, a life cycle approach and how can we do institutional shifts in social protection, I think one of the things is that we need at the macro level an overarching social protection, social security architecture. And this is not a new idea. This has been brought up by both of the labor commissions. It's been brought up by the National Commission on Enterprises in the Unorganized Sector, which was led by late Dr. Arjun Sengupta, and so many other commissions. And I think it's time that we think about this because, as you mentioned, Aniket, there are 20,000 schemes. There are all these piecemeal schemes. Some are duplicating, some are overlapping. And the time has come now to have an overarching, I think, an umbrella legislation and an umbrella architecture, first of all. Secondly, they should be universal. This is something that we've been pushing for a long time. We all know very well from our work on the ground, inclusion and exclusion errors. And if you had universal childcare, if you had universal healthcare, and then those who are taxpayers, you could figure out how they can contribute and pay back into the system. But that is what solidarity is about. It's not just poor people forming a risk pool. It's all of us as citizens forming a risk pool, solidarity pool, and supporting all citizens. I think very importantly, to make the institutional shift, I'm afraid we have to change mindsets. There's so many mindsets to change, a long list. First of all, thinking holistically, thinking from the lens and the perspective of the informal worker, of the Dalit or the Adivasi at the grassroots level. And of course, these dialogues and consultations help. I think also investment. I remember during the late Dr. Arjun Sengupta committee, which is about 15, 20 years ago, we calculated the extra cost for an umbrella social protection legislation would be 0.5% of GDP. Now, it might have gone up, but I'm trying to say that it's not some huge, unbearable cost, especially if the schemes are rationalized and converged. I mean, we have been asking for universal childcare. We've been asking, there's ICDS. You have a system. You have a framework. Another 1% of GDP will make it universal and make it according to women's hours of work. So there's that. And I think at least starting with the basic floor level social protection. India is a signatory to the ILO social protection floor discussions. So at least basic. Start from there and build up. And then importantly, flexibility. one size doesn't fit all. This is a huge country. What works in Jharkhand may not work in Gujarat and vice versa. What works with tribal communities won't work for other communities, for example. So I think decentralization to the states and even lower down to the district, and I would even say to the blocks if possible. And also there's a lot of innovation in the states. It's not just civil society, but I found, for example, in Meghalaya, they had very interesting innovations on childcare. So I think there's a lot that can be done, cross-learning, and rather than building a vertical national authority edifice, if we have horizontal solidarity organizations and involving these membership-based organizations, unions, cooperatives, self-help groups, federations, in the actual design and implementation and monitoring, then I think we have a dream for social protection for all Indians.
Great committee. So, Madhu, I have a question that's more like the golden challenge. That one I'm asked often from donors, and maybe you relate to it, but how do you shift from facility-driven access to self-empowerment that the communities themselves can ask for entitlements? And are there cases where you're able to achieve that? Or are you going towards that, and what will it take? Yeah.
So I think, yeah, I mean, there's no one answer to that. I mean, so what in the case of Pradhan, the kind of approach that we followed is one, I think, there's no alternative to actually having civic literacy, more civic literacy of communities. So people have to start looking at themselves as citizens rather than as beneficiaries of, government programs, so that which alters the kind of relationship that they see of themselves as, having voice and agency to actually, negotiate and share, etc., and build partnership with, departments and governments. So that's one. The other thing, is that we've seen that, small things and visibilizing early success also leads to, more lateral and horizontal learning and more encouragement for people. The third thing is, also collective action is important and facilitated access, because, it's difficult to imagine that, a citizen living, in a Mudu in a remote forested village would be able to, access entitlements. And there's a significant level of, education that is required. For example, just taking the example of health insurance, just, for a citizen to imagine, for an individual to imagine, of such a, a context wherein this is possible, and what are the kinds of whatever permissibles and not permissibles, etc., and contextualizing into, into the context of a rural economy requires several iterations and learning cycles. So I think there's a huge, chasm that we are kind of looking at. The other thing is, which, and I'll take off from what Mirai said, decentralization. And decentralization, not only even a block in India, is kind of a large unit. So actually there's no alternative to actually making gram panchayats really functional and, have the agency required and the kind of bandwidth which is really needed to build a relationship with citizens. And in that context, having federations as citizen representatives, particularly women's collectives, and panchayats to collaborate with each other and also collaborate with government programs at the last mile. This kind of a tripartite kind of a collaboration is really kind of essential. Just to, go back to, what I've seen really, what has been very inspirational is, the kind of change we saw when, there was a small help desk which is operated by the SHG collectives nested within the panchayat office, which acts like a trust building, and not just trust building, but really a service delivery gap between citizens and panchayats. And panchayats now becoming mandated to, in several cases to, they're mandated or legitimized to act as, legitimate institutions. So having this kind of a small mechanism actually serves, ticks several boxes. The other thing that I saw is, when you invest into panchayats, actually the panchayats really begin to function and exercise oversight on functioning of several, last mile service delivery, particularly in the case of health, education, childcare, etc., which is beyond entitlement. It's actually very, very important, but it's not a one-time delivery of a pension or a, or a ICDS or a nutrition program. It's continuous. It's 24/7. And if those institutions, those service delivery has to function, so therefore there has to be a continuity of, and because, the people who are kind of the teachers working in schools or the, the health workers that are working in the health delivery apparatus are also facing several challenges. So there has to be a forum which is responsive and listening to the challenges and responding to those challenges at the last mile. So things like that, Sharon, I think are really required. But thing is that these are very, very labor-intensive processes. So who's going to have, who's investing into these processes? And do we really have the bandwidth and the time, patience to actually invest into, all that is required to be done? So, yeah.
Great, thanks. I think that's an excellent answer. I think you answered very gracefully. And I might use some of your insights next time someone asks me that question as well to see. Great. So, Aniket, I think since we're the system, I think Madhu mentioned trust. I'll want to ask like a sort of like parallel question. Digital trust is critical. And how does digital trust, how do you gain digital trust with your system as well? Because you also have to sort of like build a little bit of system like Madhu mentioned, which is building like physically in the community. But trust is a critical driver for what you're working on.
No, I think some of the things is just initially like now built on how are you delivering through digital services, using consent, how are you using digital and literacy, because that's very important, how are you taking the community together. There is no single only digital solution for trust. It has to have that human interface because people trust people, and through that trust technology. Directly trusting technology is a challenge because it is so many complexities. And I think one of the things, for example, for that to kind of, from a technology lens, as an idea to think about is, today people find schemes. Can we get schemes to find people? Right? So, because everywhere, think of a girl who's applied for a scholarship and year on year in a village, she has to give her documents to get the same scholarship amount. Technologically, it is possible that the service finds the people. When all of us go to the airport, some of us from here will use DigiYatra to enter the airport. That is possible. So why can't we think using technology that schemes, I think that from a tech perspective can be a great step towards building trust. When the service comes to me, and then there are enablers in the ecosystem who are guiding and consulting and supporting and providing that post-service support. So again, it is possible, building on both the points that Mirai and Madhu made, that, who's going to invest in this, number one, because it can't be just the government. It has to be a larger ecosystem of investment, that this is important. Because the other narrative around schemes that we always hear from mostly us, people like us who are, as they say, taxpayers, only income taxpayers, everybody pays GST, but that these are freebies, right? So even if you assume this is public money and freebies, how do you make sure it reaches the right person at the right time? And I think there the ecosystem has to kind of support, and that ecosystem is kind of all of us. How does that 10-20% of India really look at this as a point where there is efficient use of public money? And I think there we can, there I think to your broader question, I think there is a huge possibility of building that trust.
Thank you, thank you. I think we just have a few minutes for question. Is there maybe 10 minutes left? We can ask questions. Yeah, great. So just to summarize here, one thing we know is social protection is not a privilege, it's a right. I think we definitely need it. True empowerment goes beyond enrollment. It requires agency, voice, and continuity. Last mile solutions need to combine trust, technology, and community institutions, which we had a brilliant panel to display. And to Mira's point as well, we really need to refine and rethink the social protection system in light of the future as well. So with this, I'll take a few questions from the crowd. And just a minute. Yeah.
Thank you for the wonderful session. Thank you. Okay, anyway, I'll just. Thank you for this wonderful session. I am Daniel from United Way, Mumbai. We empower a lot of women across the country. I want to know, as an organization, we take our 90% of projects as CSR project, which comes in the last quarter of the financial year. And we have money to do this. But then, since these projects are coming at the last phase of the financial year, and we completely agree with all the points that you've made, without social protection, we can't, that will actually prevent women, to get into the poverty. So what is the strategy that we have to adopt? Like, what are the certain low-hanging schemes that we can go about it? Especially many people who are sitting here also might face a similar kind of problem, where we will not have much time to work with this women to empower while we're promoting the livelihoods of the women. How we can tackle such kind of situation, and how we as NGOs or agencies working like us can develop women on this.
So I would say, I don't know if that solves the particular situation that you said, Daniel, but I would say invest into institutions. It may be a slightly medium-term strategy, but in the long run, that those are things that will remain. And invest into building capabilities of local people, the local champions, the local village community, and leaders that exist. I think those are things that will stand us in good stead, is what has been our experience.
So just to add on, agreeing with Madhu, Daniel, first of all, I mean, you're going to have to explain, I know it's hard, to the foundations that things cannot be done in a rush. It's the slow and steady building, and also getting access to entitlements. I just gave the example of Jyoti Ben. It took a year for her to get her entitlement. So it's not going to be done by March 31st. That's the first point. The second point is you asked about low-hanging fruit. A couple of things you could start with. Mostly ICDS, the Integrated Child Development Services, is available in our country. It doesn't work well everywhere. In some states it does, in some states it doesn't. But we found that children are a good place to start because it brings the community together, and there's already infrastructure on the ground. So that's one low-hanging fruit. And the other is the PMJ. I mean, it's true that many people don't have cards, so you could help them get cards, so at least they begin to get their entitlements, 5 lakhs up to 10 lakhs for the family in some states when people get sick. And the last suggestion I have, which I just very briefly touched on, which is something concrete in the community which builds trust. is what we call a Seva Shakti Kendra, which is very similar to the facilitation center you mentioned in the panchayats. You can have it in the panchayat, you can have it in the schools, we have it in our city, we have municipal urban health centers, we can have it there. So these are places where people can come for information on all these many schemes, but also can get advice into how to navigate and how to access. So these 2-3 things I would say are low-hanging fruit. And if you can digitize, so much the better.
I mean, and just one point, I think, just very practically, like, if you can convince CSR that documents are important, because I've also had a lot of conversations where funders think schemes is everything. For a citizen, document is everything. A caste certificate is the potential better or most important way for someone to get out of generational poverty. So, and it takes a lot of effort and time, 14 steps to get a caste certificate. But if funders can understand that getting an Aadhaar correction is a very important service, because a lot of organizations who work in this space, the problem they have with CSR funders and others, that they want how much money has been unlocked. Everything cannot be unlocked in a short time. But if that enabling documents can also be communicated to funders, that is critical. A PAN to Aadhaar linkage, a land certificate. These are crucial identity and other documents to enable. Once you get information and documents to citizens, most citizens get the schemes themselves. By going to the Gram Panchayat, by going to the political person, because they feel, especially in rural areas where they feel they have some agency. So that I think can be pushed to funders a lot.
Thanks. Any other questions? Yeah.
First of all, thank you so much. It was a wonderful session. I'm actually riding in the same boat as Daniel. Daniel is my reporting manager. And, but we are working on modules where we can do a capacity building of community workers, leaders, party workers, like you said, who can have skills, right information about schemes, as well as, life skills, having empathy, having patience, also understanding a side of a government employee, how he is also struggling, and the same patience with the woman or a man for whom we are getting the scheme, and the same patience level with the other end at the government office. So we are working on a module currently. Thank you so much, Madhu ma'am, for mentioning SC, ST, OBC, because along with the gender lens, I think at the end of the today's sessions, you mentioned OBCs as well, because a large chunk of country's population is into the category, and so many castes. I will come to the specific question. There is a lot of diversion of funds of, which is meant for the policies for scheduled caste, scheduled tribe, and OBCs. Like we had news from Delhi few years ago. We also, now a pension scheme is giving 600 rupees, 1,000 rupees, 12,000, 50 rupees, and the schemes like Ladli Behan Yojana in almost half of the states of the country are coming up with 2,000 rupees, 2,500 rupees. So directly or indirectly, these schemes, nullifying what we are looking at, because these pension schemes are not for the 600 rupees, or it's not a money giving, but a dignity giving schemes for a poor widow or a old age couple who do not have children. Those 1,000 rupees or 1,250 rupees are for dignity of the person. But these schemes like freebies and direct money giving schemes, like I want to know from the experts, like what do you think about these? This is in a way, nullifying or diluting the core of social justice. Is it?
I mean, I will not comment on is cash transfer DBT, because we don't know the actual outcome. They're not enough studies out there. But It's, I mean, in my opinion, if money is reaching people, it's great. But it's just on the part of money available. There is a fund with the government which is called Building and Construction Worker Fund, which every builder in this country has to put 2% SS. That money is 57,000 crores. There is a district mining fund in India for districts where mining is there. That fund is now 44,000 crores. There is a national fund of India which is 17,000 crores, which all your bank accounts where 500, 600 rupees goes unclaimed, it goes to Ministry of Social Justice. It is supposed to be spent on people with disabilities. That together is 1.1 lakh crore, which is lying unspent. So if governments are trying to do cash transfers, our first question has to be, what about all this money which is sitting? And why can't we mobilize this to people who actually need it? Before we question the concept of cash transfer is my thinking here, because there is so much of public money lying which we are not able to mobilize to people for whatever reason.
I just wanted to add, you know, I mean, very recently, I mean, just 2-3 days before, I was listening to this conversation between, you know, where there was a prominent economist, etc., and he was doing this very interesting calculation in the sense of we as citizens, all of us is kind of contributing to the, you know, tax, this thing, and industry. So you're seeing, you know, average contribution, what is it that we make? And against that, you know, if you average out the cash transfers, etc., and compare it with, you know, also, you know, what the industry, you know, is kind of getting. So the figures are very, very surprising. So it's, you know, much, what is going as subsidies in terms of either land subsidy or tax waivers or, you know, I mean, or loan waivers, etc. The figures are kind of, you know, very, very surprising. So I would also urge you to take a look at that, you know, those.
Yeah, and also I think those of us here, we should now reject this concept of freebies. You know, 500 million people in this country are informal workers struggling for survival and also contributing massively to India's GDP, upwards of 50%. We haven't even calculated properly their contribution. So surely they're entitled to some kind of basic social protection. And I was talking about an umbrella sort of coverage architecture, but within that, special schemes for Dalits and Adivasis can be integrated. They should be there. No one's saying that they should go away. So I just would urge us to think also of what we owe to the hardworking people of the country, and that it's not freebies or reveries or whatever we want to say.
Thank you. Any more questions? Should be okay? Oh, okay, we'll take one last one. I think we almost exhausted our
I'm Ruchi Jain. I run Taru Naturals. We work on value chains for small-scale farmers. Love the conversations here. The main issues we are facing is the information trickling down to small-scale farmers. And you rightly said about the Panchayat office. It could have a center. You said a Seva Mandal could happen on the village level. But I see that every NGO, every tech startup who has an app, like Digital Green has, you know, another information thing for the farmers. There's so many, Cropin has something. So every vertical, rural development, education, farmers, schemes, financial inclusion, at the end, it's information which needs to trickle down to one farmer, his family, a unit, a village, a taluka, a district. So maybe, yes, a panchayat office system needs to be set up, but just brainstorming and wondering, what is that information system you envisage for that farmer family? I mean, there are too many information systems here. And I know it's a difficult question, but can you think of a vision which needs to be implemented? Because we're also really struggling on something like that.
No, I think I just feel one is that one thought that comes, it is complex, but I think one thought that comes to that information to the farmer is that somewhere I'm just reflecting that is it our thinking that the farmer can't comprehend so much information because, for example, all this information we can. We consume multiple source information and we are able to today figure it out whether using Google, ChatGPT, Perplexity, different formats or by talking to people. So one is I feel all of us think that the farmers or communities can't process it. My sense is they can. At the same time, I think as the kind of choice and information increases from different sources, I think most communities and citizens will take that kind of decisive choice what they want to follow and what they don't want to follow. But one thing that I do feel is that there is sometimes a resistance on the ground by different organizations and ourselves thinking that a farmer, or in this case, will get overloaded with information. At the same time, we are actually ourselves overloaded with information and we feel it's great access to information. So I don't know, like, should we first ensure that information reaches and then process? But I agree it's complex, but we should let different channels go to these systems is what I feel.
Yeah, no, I just wanted to say that while I agree with you, we shouldn't say that farmers can't comprehend, but on the other hand, it is confusing. For example, the women we work with, they have e-Shram card, they have PMJ card, they have so many cards. I mean, sometimes they're like, "Ye kaun sa, which one is for which," and so on. It's not easy to remember this when you have a lot of other things going on in your life. So I think there is a case for integration, digital integration, and I think we are moving towards that. You know, digital integration with people's DigiLocker for their documents, digital integration of some of the schemes, so that they're more streamlined and simple for people to understand. People do understand, but also we want to make it easy for them to understand. So that's something that we've seen, all these plethora of cards. The net gainer is the card company, quite frankly.
So I just wanted to add that, information, I think, is one of the enablers that is a critical enabler, but I think there's several other things also which are needed for farmers to take that plunge to whatever, from one level to another level or one orbit to another orbit. And that's, I think it's underplayed the role of service delivery and good quality service delivery, and which is reliable, which is predictable, which is consistent. That's the other thing. So information, I think, is overrated. I mean, so besides information, who's kind of investing into the last mile service delivery, which farmers find useful, is the other question. And are we kind of also investing adequately into building that service architecture, apart from, bridging the information gap? So, and that's how, all of us learn. I mean, Aniket doesn't get, but I get quite overawed by the plethora of information, and the same is true for any, farmer, etc. I think I'm equally, kind of flummoxed by, yeah.
Thank you very much. I think this was the last panel of the day. Thanks a lot for the panelists. It was a pleasure. My last moderation, the panelists were fighting on stage, so I was debating, so that was interesting. This was very elegant and professional and super interesting. I'd like to thank Vipin as well for inviting me. I can never say no to Vipin, so I'm here today. And thanks a lot for everyone who attended. It's been a pleasure. Thank you very much.
I thank our moderator and the panelists for this very topical discussion covering pathways to enhance the last mile delivery systems in enhancing access to social security for all. May I request you all to please join us front and center for a group photo op. And with that, we have come to the end of day one of the Livelihoods India Summit.